Hello everyone, Philip is here. For some time now, I have been talking about sickle cell, all that you need to know about sickle cell. And today I am looking at pregnancy in sickle cell. Can a person with sickle cell get pregnant? How safe is pregnancy in sickle cell? What are the risks that you need to be aware so that you take measures to overcome those risks? This video is not to scare anyone, but to give education and to help you know what to do if you are a sickle cell person or you know somebody with sickle cell. So when one is pregnant, there are a lot of changes that occur in the body of that individual, and so more demand is put on the body of a sickle cell patient. There is high demand for oxygen needs, high demand for blood, there is hormonal changes, and sickle cell patient, there is risk of clots because from my earlier videos, I have talked about the fact that sickle cell is shaped like a sickle, and there is likelihood that these cells are very sticky and can clot or clamp together, what we call agglutination, and that is very likely when one is pregnant. So I will quickly talk about the risk that comes when a sickle cell patient gets pregnant. One of the risks that occurs is frequent pain cries, as we have already discussed that sickle cell patients have a lot of crisis when it comes to pain, what we call the vaso-occlusive crisis, because when the blood vessels are not taking enough blood and supply of oxygen to the tissue starts to undergo stress and pain receptors are activated. So you are going to experience a lot of pain, and there is a lot of pain crisis in sickle cell. There is also severe anemia. So for sickle cell patient, the normal days that blood takes to break down, the normal 120 days, on average in sickle cell, it is far earlier than that. So patients with sickle cell are likely to have low blood levels or low hemoglobin levels, and anemia is very predominant in sickle cell patients when they get pregnant. There is also infections because the more the bloods are breaking down so frequently, the more the blood cells, the white blood cells reduce, and prone to infection is very common. There is the risk of blood clots, as I said when I started the video. The bloods are very sticky, they can clump together, they can clot, they can block the vessels and stop or reduce the flow of blood. So there is likelihood of blood clots as well, which could cause deep vein thrombosis and other conditions of the body. There is high blood pressure risk in pregnancy. So if you are a sickle cell patient, like all other pregnancies, there is likelihood of developing high blood pressure, and sickle cell patients also have that greater risk. And there is the need for blood transfusion because I've said there is high levels of anemia occurring in sickle cell persons. So blood transfusion need is also very common. So these are some of the risk that occurs when patients or when a person with sickle cell gets pregnant. In that the risk to the mother, it is very crucial to keep antenatal care appointments. Don't joke with antenatal care when you are pregnant, especially when you have sickle cell, because there are a lot of risks that needs to be looked at, that needs to be addressed. I will talk again about the risk to the baby when you are a sickle cell person. What are the risks that comes to the baby? Thank you for watching this. See you shortly in the next episode. Bye.